Hey guys, Nurse Nate here. I want to show you how to give a capsule of medication with granules in it, like esomeprazole, safely via PEG tube without causing a clog. Okay, so when you open a capsule of esomeprazole or Nexium, it's going to have little granules in it instead of powder, so it won't dissolve in water just by stirring it up. So I don't have any esomeprazole, so I'm going to use quinoa, and it'll look like the same thing. So I'm just going to put a little bit in my cup. You're going to want to do this in a cup of water with about 30 mils of just plain tap water. And then when you suck up all the granules, you'll see in your 60 ml syringe, they kind of tend to float to the bottom. And the danger is when you insert the syringe into the PEG tube and you have all of this granules down at the bottom and then you push it from here, it could very likely cause a clog in your PEG tube. And then you're going to have issues trying to irrigate and flush it, and you may end up having to replace the PEG tube. So we don't want that to happen. So in order to stop the chance of a clog or reduce the chance of a clog, you essentially, for 15 seconds, make a little tornado in your syringe, and then you have all the granules floating around there for a second. And they're actually smaller than the quinoa, so they'll kind of float a little better. And you want to do this right before you insert into the PEG tube and then flush. And then you don't have all the granules kind of collecting at the bottom. After you safely flush the granules, the medication through the PEG tube, then you're going to want to follow that immediately with a flush of water. So that's it. Make sure you swirl so we don't get a clog in the PEG tube and have any issues. Thanks, guys.